Test, test. Test, test.
Got it.
Can you hear?
Good morning, folks. Thanks so much for joining me here on Wave Now. I'm Myra Ansari. So if you didn't know, April is Child Abuse Prevention Month. Last week, we talked about what child abuse is and some of the basics. And throughout the month, we're going to be teaming up with Norton Children's to talk about child abuse, bringing awareness to it. So today, the topic and the focus of our conversation is about impaired givers and safe storage. So joining us today is Alex Pasamonte. She's a nurse coordinator with Norton Children's Prevention and Wellness, and Emily Valente. She's a pediatric protection specialist. Thank you so much for joining us today, ladies. This is something we could talk about for quite some time because child abuse is such a problem in Kentucky and Indiana. What's the message that you have for folks today?
I think our goal for today is just prevention and encouraging and empowering caregivers to make safe decisions.
What's a safe, I know this seems like a basic question, but who is safe to care for your kids?
In terms of choosing a safe caregiver, there's a lot of things to consider. And one of the main things to consider is making sure that the caregiver that you're choosing for your child is not impaired or under the influence of any sort of substances. So that is something super important to consider. And I know Alex has a couple of additional thoughts as well.
Yeah. So when, we're talking about impaired caregivers and making sure your substances, medications are stored correctly, it's kind of two faceted. So, we really want to encourage caregivers. So even if it's not your child, if you're watching someone else's child, maybe your aunt, neighbor, grandparent, that you are storing medications, substances appropriately. So that can look different depending on your definition of what a medication or substance is. But Emily and I just really want to spread awareness, especially as things like cannabis, so THC, gummies and candies are becoming more prevalent across the country, that we are discussing those items as well.
What should parents do? Because this is a real struggle for a lot of folks. If they suffer from substance use disorder, they have kids, what do they do?
I think it's really important if there is a caregiver that has a substance use issue that they ensure that anytime that they are using any sort of substance, that they're not in a caregiving role of their child. So anything you can do as a caregiver, leaning on support systems, friends and families, that if you're ever under the influence of any substances, that you're not taking care of a child.
And it's not just illicit substances. There are a lot of medications that can kind of impair your judgment. They can make you sleepy, and that can really impact what's happening when you're watching a kid.
Yeah, certainly that's really important to consider. And anytime you're prescribed a new medication as a caregiver or a parent, it's important to ask your doctor about if that medication can impair you and if you're safe to care for your children while taking that medication. One medication that's really common that has kind of some sedative effects or that can make adults or caregivers a bit sleepy is Suboxone. And that is a prescribed medication oftentimes. And just talking to your doctor or your prescriber about safe ways to take the medication. A lot of times when you take a new medication, your doctor will talk to you about whether you can drive on it or work on it or something like that. So letting your doctor know that you are a caregiver for children and asking them questions about how to safely take that medication. Something in particular that I recommend with any medication that can make you sleepy is when you do take that medication, just being very aware of when you as a caregiver are getting sleepy. So if you're feeding your baby and you're like, man, I'm feeling really sleepy, you might need to tag in another caregiver and say, hey, I need some help. I feel like I'm about to fall asleep. And maybe put your child down in a safe environment and rest for yourself. Because what we see sometimes is with medications that can sort of have a sleepy or sedative effect is that parents are feeding their baby or something like that and then fall asleep and maybe baby gets dropped or it's not a safe sleep environment for baby anymore.
Yeah, or you can accidentally smother your child without even realizing it. There's so many things that can go wrong with that. Let's talk about alcohol too, because of course, as we know, that can impair our judgment as well.
Yeah, certainly. So it's kind of on the same topic that we had talked about earlier, which is making sure that there is a safe, unimpaired caregiver. So if you know that you're going to be drinking, just like as a responsible driver, you want to look for sort of a designated driver, of course, and you want to look for a designated caregiver for the child. So if you're expecting that yourself or any other adults that you're with might be drinking alcohol, you need to make sure that you have a designated safe caregiver for your child that's going to be sober and not drinking. So that's really important to take into consideration as a parent when you're drinking alcohol even.
Sometimes I think, we're taught to be polite and not, offend anybody. And sometimes, when we have a gut feeling, something's not right with maybe the babysitter or with that family member, and you have that gut feeling, but you don't want to ask, can you give folks advice just to kind of say how to kind of approach that situation? Sometimes, maybe my gut feeling is right and you don't want to have any regrets.
Yeah, I think it's really important to trust yourself. So as pediatric providers, we always recommend listening to parents and then that parents listen to their own intuition and concerns. So if you have concerns about someone that you're leaving your child with or you're thinking about leaving your child with, take that very seriously and maybe find someone that you feel more comfortable with or safer with to leave your child. So definitely, like you said, if you have a bad feeling, listen to yourself and listen to that feeling because obviously children's safety and your child's safety is the most important thing.
Sometimes I know as parents, you've got to go to work, you have obligations, and you just want someone to watch your child. And there are a lot of desperate parents out there, but you don't want to end up in a situation that you'll regret at all.
That is certainly a really tough situation. And I know that a lot of families are lucky to have quite a bit of family support. And we recognize there are some families that don't have a lot of support. And I understand that can be really, really, really tough. And it can be a very tough decision between going to work to provide for your family and having to leave your child to someone that you're not fully comfortable with. But definitely really important that if you have that feeling that your child isn't safe, do not leave your child with that person.
I know you all see it all at Norton Children's, some of the worst cases in our community, but how common is it for children to get their hands on medications or substances? Does it happen a lot?
Yes, so it does happen very often. From our specialty team, typically a nurse from our team will go to the bedside anytime there's a child that has any sort of ingestion. So that could be an illicit or an illegal or recreational substance, or it could also be a medication that a kiddo gets a hold of that's a prescribed substance that just isn't safe for children to get a hold of. And honestly, from our team's perspective, we see children who have gotten a hold of something that they shouldn't multiple times a week. And it can be really dangerous for children. A lot of times they can be in the ICU or admitted to the hospital as well.
And a lot of times, I'm assuming, correct me if I'm wrong, sometimes parents don't want to be forthcoming about what's going on in the home, which complicates things because for you all as medical providers, you need to know what you're dealing with as fast as you can.
Yeah, that's certainly true. And I empower and encourage every caregiver to be as honest with healthcare providers as you possibly can be, because getting a really clear history or really clear understanding of what happened at home that led up to a child's hospitalization can make a massive difference in the child's care and in their care needs being met. So certainly the doctors and nurses at the hospital share a goal with the parents, and that is keeping the child safe and helping a child recover from potentially an ingestion or another emergency. So working with the doctors and nurses at the hospital and being as honest as you possibly can be so that your child gets the best possible care as quickly as possible is super important.
And what's the proper way to store medication? What would you give advice to folks on that?
Yeah, I'll jump in right here, but the Center for Disease Control recommends that storing medication. So I like to clarify, kind of like I mentioned earlier, not just prescription medicines that come, in the orange bottle with the white cap. A lot of people, kind of have that or illicit drugs in their mind, but really any ingestion of any medication. So it can be even like, melatonin gummies, it can be Flintstone vitamins, THC gummies, diaper rash cream. So really anything that if ingested can change any of the chemical makeup in a child's body needs to be stored this way. And the Center for Disease Control recommends storing medication up and out of sight. So that's two different components, making sure it's up out of the child's reach, but also out of sight. So one thing that I see a lot is they keep medication, parents, caregivers keep medication up on a kitchen counter. But kids are smart. They're clever. They can climb kitchen counters pretty easily. So not only do you want it up, but you want it out of sight. So that's where a medicine cabinet would be a really great place to store it. If you have a kitchen cabinet with a closed door, that's another good option. And then to take it a step further, the American Academy of Pediatrics, which is the governing body that makes decisions specifically for kids, they recommend purchasing a medication lockbox or a medication lock bag, and keeping that out of sight. So that's just kind of a little extra step of security. Because, and like I mentioned earlier, we're also talking about the cannabis gummies and candies, things like that. The Kentucky Poison Control Center did a report, and in 2024, the overall calls, or over the past 5 years, the overall calls regarding cannabis have more than doubled. In 2024 alone, about 37%, which is around 400 of those calls were about kids 12 and younger. So by looking at that data, that's telling me that these kids are accidentally getting into medication and accidentally getting into these substances.
I have, from doing so many stories with you all, poison control programmed into my phone because, we've talked about it so much that I did it myself, and I'm so glad I did. But what should parents do or caregivers do if their child has ingested something and you're in that moment of panic? Okay, what do I do?
Yeah. So a couple of things to consider. If your child is awake and alert, maybe they're playing or maybe they're a little bit sleepy, but they're still responding to you. Calling the poison control number is a really good first step. That's 1-800-222-1222. Like you mentioned, I really encourage caregivers to go ahead and put that number in their phone. It's pretty easy to Google, but in a moment of, panic, it's nice to have it programmed in. So calling the poison control number is a really good resource. They can tell you what to look for. They'll ask you some questions about what you think was ingested, how many maybe. And that is kind of jumping back into safe storage. A reason why I always tell caregivers to keep the medication in its original packaging, so that if someone is watching your kid or they do get a hold of something, you know what they've taken, if you're missing some medication, things like that. If they're not responsive, so maybe they're not breathing, maybe they're not responding to your voice, you call 911 right away. So poison control number goes out the window. You need to call 911 because that child needs emergency medical attention. When you call poison control, they might suggest taking your child to the emergency room, or they might say, call their pediatrician the next day. So it's a really good resource. But just as a reminder, if your child is unresponsive, not breathing, 911 is the number you need to call.
Okay. And another thing I want to talk about, we talked about alcohol, we talked about medication and drugs, safe gun storage. That is critical. I cannot tell you all how many times in our community we have seen cases where children are accidentally shot, because a gun wasn't stored properly. It happens way too often. Let's talk about that and what parents, caregivers should do. Even if you're dropping your kid off at a play date, I've asked parents before, hey, do you have guns in the house? How do you store them? Blah, blah, blah. And, I've been forthcoming about what's in our home as well. So that sort of thing is really important to talk about too.
Yes, absolutely. Just like you said, Myra, encouraging people involved in your child's life, and your friends who have children, really, really encouraging them to have these conversations. Um, that is really what we're pushing is, asking about if there are any firearms in the home and how are they stored. So in order for a firearm to be safely stored, the triple safe storage method is what it's called, needs to be used. So a firearm needs to be stored unloaded. So really important, you remove all bullets. So even the chambered rounds, they need to be taken out. And then it needs to be locked. So there are lots of different locking devices, locking mechanisms. They could be a cable lock, a trigger lock, a lockbox. Some people have a big gun safe, but the firearm needs to be locked. And then the ammunition needs to be stored in a separate locked location. So all of these three things need to be done in order for a firearm to be considered stored safely. And before you send your child over to anyone else's house, even if they've been before, if you've never asked, I really encourage parents, caregivers to ask, do you have a firearm in your home or a gun, and how is it stored? Those two questions go hand in hand, because not only do you want to know if there's a firearm in the home, you want to make sure it's stored correctly. You would never, if your child is allergic to strawberries, you would never send your child over to someone else's home without letting the other parent or caregiver know. This is kind of something you want to approach in your daily or in your safety questions. So, if your child's scared of dogs, you're going to ask if there's a dog. You're going to ask if there are other adults in the home. You're going to tell them about allergies. This is just adding that to the list, approaching it in a non-judgmental way. It's worth it to have that kind of uncomfortable, awkward conversation for a minute and keep your child safe.
Absolutely. I've been there and I felt that, oh gosh, can I ask that? I don't want to offend, but the peace of mind that you'll have. And I preach to my kids over and over, if you see a gun, do not touch it. Like drilling it into their heads, because kids are curious, and they don't understand what's real, what's fake. And oftentimes the outcome is terrible.
Every family, every household is different. So if you feel, and unfortunately it's happening a lot, like you mentioned, kids are hearing about it in school, they're doing drills, they're seeing it on social media, so it's normal for them to have questions about it. So it's okay to have these conversations with your children about firearms, and for younger kids, telling them exactly, stop, don't touch the gun, and go tell a trusted adult. With older kids, you can talk about it a little bit more. If someone ever tells you, hey, I have a firearm or I have a gun, it's not loaded, it's fake, just tell them to never trust that person and they need to leave the situation immediately. So, unfortunately, as it's becoming more prevalent, having these conversations with your kids is probably going to come up.
I think sometimes people fail to realize, and we find out the hard way, it doesn't take much for a gun to go off. And, sometimes people may not understand, well, the kids were so little. How did they pull the trigger? And can you talk a little bit about that as well? Just how it doesn't take much for something terrible to happen?
Yeah, absolutely. So a child as young as 18 months old has the dexterity to pull a trigger. In case people aren't aware, firearms are the number one cause of death in kids less than 18 years of age, starting in 2019 and continuing on to today, which is incredibly devastating. So in 2020 alone, at least 125 toddlers, so toddler ages 5 and younger, were shot by a firearm. So, by looking at that data, as someone who, looks through data and analyzes it, that tells me that, 4-year-olds, 2-year-olds, 3-year-olds are not looking to find a firearm to shoot themselves or someone else. Those are accidental. So that means that gun was stored, loaded in a place where they could get it, and they accidentally pulled the trigger. So, if you've ever handled a gun, the trigger is pretty easy to press, even if your finger's not all the way in. So it's really, really important that you store your firearms appropriately so that these accidents don't happen, because it's really, really devastating. Really, any, any child injury is devastating, but the preventable ones are incredibly painful for us here to witness and to care for, because we just feel like we could be doing something more. And so anytime that this comes up, we really, really want to empower caregivers to have these conversations to prevent injuries like this.
Absolutely. And as you mentioned, these sort of injuries, these sort of deaths, they are 100% preventable. So we have to be responsible for the things that are in our homes and what we use when we are around our children. Ladies, Alex and Emily, is there anything that I did not ask you that you want folks to know today?
I think one last thing to mention just about medication storage, similar to gun education, gun safety, it's really important to talk to your kiddos about medication. I know sometimes as parents, when it's really difficult to get children to take medications, you might say, it's like candy, take it like candy or something like that. But you want to make sure that with medications that your child, similar to a gun, understands that they can be unsafe and that they are not candy and they're not something to play with. So talking to your children, I think, is one of the key messages here about safety overall.
Yeah, kids are innocent. We have to be better as adults and caregivers for sure. Thank you so much for your time today. I really appreciate everything that you both do. Again, April is Child Abuse and Prevention Month. Share this stream with your friends, your family. The more we can educate folks, the better for sure. I'm Myra Ansari. Hope you have a great day.